the minister is yet to arrive. We are told he'll be here in the next few minutes. But what we understand, as you rightfully stated, he will be launching Breast Cancer Awareness Month, and he's also bringing two very important missions to this facility. Right now, Desiree, we're in the radiology unit, and I'm joined by the MEC of Health here in the province to tell us more about this launch. MEC, thank you so much. Dr. Phophi Ramathuba, thank you so much for speaking to us. The minister is coming today. What can we expect?
Morning, Pimani, and morning to all your viewers out there. As part of the breast cancer awareness campaign, I think the minister will be launching this month in the province, wherein we felt as a province we need to bring him to this part of the province, because Sekhukhune District, it's one of the most rural districts that you can talk about in the country. Now, for us here, we are saying everything that we do in the province, since you understand that the province it's 80 to 90% rural, whatever we do, we must be able to prioritize rural areas. So in this facility, we have procured and we will be commissioning today two equipment that both the Premier and the Minister will be handing over to the people of Sekhukhune. That is the mammogram. We all know that women in the rural area takes time to be diagnosed in terms of their breast cancer. Some of them are not even aware the queues that they have to travel to Pietersburg Hospital and Mankweng, and I think that we are going to cut short that particular trip. And also our CT scan here, which you can see for yourself, that we said all our rural district, all of them will be having this, and this was the last hospital to receive the CT scan in our province. So our hospitals in the rural areas have got CT scans now. You don't have now to travel to Pietersburg and Mankweng just for you to be done a scan. And in the past, when I started, sometimes you will have to drive all the way to George Mukari or Steve Biko. So today we can say every district has got its own CT scan, and the mammogram, this is the second one in the province. We started at Mopani, and we will be moving to all the other districts that are remaining before the end of this year or this month. All our districts will be having mammogram, therefore in honor of women, and to show that as a province we take the battle in terms of fighting breast cancer very serious, and we prioritize women's health, because while you do have 1% of the breast cancer affecting men, but majority of 99% of the breast cancer that we have are affecting our women, and late presentation, it's the major cause of poor prognosis.
Talking about late presentation, and we know that early detection helps in that fight, but let's talk about treatment of breast cancer, any other form of cancer in the province. You and I spoke at length about a lady who was struggling to access treatment. She was from Mopani and she had to be moved to Polokwane. Let's talk about, if a lady right now comes to this mammogram and it's found that she has breast cancer, what then happens? Do we have facilities in the province to treat cancer?
I think what we must appreciate is that in the past, because we did not even have this diagnostic equipment at this area, therefore either the doctor will have to be forced to do a biopsy and wait for the results of the biopsy. And when you are doing the biopsy, what is unique about the current mammogram that we have, it can be able to pinpoint and direct you to say that's where you can do your biopsy. So every patient, before they could go through the biopsy, they will be able to go through the mammogram, and after that we can be directed to say where do you do a biopsy. And after that, what I can tell you, since the time when we discussed and we had discussions, because we have been working very hard towards the reduction of the waiting period. As we speak, we've got more than 500 patients that are currently receiving therapy in terms of the radiation oncology and also the breast surgeons. So and because in an annual base, if I'm not mistaken, our cases are between 350 and 400 that we are diagnosing annually in terms of breast cancer. So now the good thing is that the surgical waiting period, which used to be between 6 months and I think sometimes 18 months, we have reduced it to just 4 weeks. Any patient who can be diagnosed breast cancer today through the biopsy, through the mammogram and all those investigations done, If the treatment or it needs surgical intervention, in less than 4 weeks, that patient will be diagnosed. If today a patient comes here, we do a mammogram scan, we do biopsy, and require to see both the surgeon or any as oncologist, radiation oncologist, it takes you less than a week. We can book you for next week, you'll be able to have a room. This is how far we have been able to reduce the waiting period of breast cancer patients.
Thank you so much, MEC. MEC, before we leave, man, before I let you go, studio is asking that you just show us this beautiful machine. What if I were a patient? What happens when I get into this room?
Or when you are a patient, you are here, this is a hospital, it's a rural hospital. There's no radiologist because it's impossible to appoint radiologists in all our facilities in the country. So when you arrive referred, the surgeons here will see you, or a doctor, you've got an accident, you need a scan to be done, you will come in here, you will be able to lie down here, and this is where you will be scanned. And in that room, that's where the miracles happens, because that's a control room where the radiologist, when he's in Petersburg or anywhere, even on holiday in Dubai, because sometimes we tend to abuse them, when he's there, he can be able to access what we are doing here through his cell phone. You will see later on when Dr. Sithole will be demonstrating to you how these things are done. So he's able to interpret and be able to give you the report. We are working with radiographers in our hospitals at this level, because we don't have radiologists, but our radiologists who are there in Petersburg, in Mankweng, our registrars who are there are able to communicate through that and give us the feedback here. So the patient doesn't have to travel. You see, if somebody was saying, how much does this equipment cost? But my question is, how much does it cost for you to get an accident and the doctor need a scan? You must get into an ambulance, which we don't have. Travel is almost 200 to 300 kilometers to Petersburg. Sometimes you get another accident. Sometimes you don't even survive that accident. But with this current systems that we're having, we believe that indeed rural healthcare matters to us as the people of Limpopo.
Thank you so much, MEC. That is the MEC of Health, Dr. Phophi Ramathuba, showing us how this CT scan works. The Minister of Health, Dr. Joe Phaahla, will be visiting this hospital later today, where he will be officially handing over this machine and another called a mammogram that helps with early detection of breast cancer to this hospital. It is, as the MEC was saying, the second mammogram that rural hospitals in this province will have.